Hi, I'm Mary McQuilkin. I'm an adult gerontology primary care nurse practitioner and public health professional, and I live and work here in Alaska. In my clinical role, I travel to rural tribal health clinics to fill in when they're short staffed, which gives me the opportunity to serve Alaska Native rural communities across the state. I'm also an adjunct faculty affiliated with the University of Alaska Fairbanks Center for One Health Research. Communities here in Alaska and throughout the circumpolar north are facing unprecedented challenges at the intersection of human health, animal health, and environmental health. One Health provides a framework for understanding these threats holistically and developing solutions by working as a multidisciplinary team together with local communities. In this video, I'll introduce the concept of One Health and briefly discuss its theoretical foundations drawn from other disciplines.
One Health stresses the vital connections between the health of humans, other species, and our shared ecosystems. One Health is a paradigm for addressing public health challenges with wide applications across disciplines. One Health combines knowledge and input from many different stakeholders to optimize health for people, domestic animals, wild animals, plants, and the environment. It aims to preserve and improve the health of entire systems rather than focusing on one individual patient or group. The overarching goal is to promote wellness for all by building a more equitable and sustainable world. The One Health paradigm has the potential to enhance surveillance capacity to detect health threats early and increase understanding of the relationship with climate change. Collaboration is a key principle of One Health. Scientists across various disciplines, the residents of communities, and other entities all need to work together as a team to solve problems. Before we keep talking about how One Health is defined, I want to quickly go over who is doing the defining. The One Health High Level Expert Panel is an advisory group comprised of international experts appointed by the Food and Agriculture Organization of the United Nations, the United Nations Environment Program, the World Health Organization, and the World Organization for Animal Health. Together, they're known as the quadripartite organizations. This group came together in 2021 to formalize the One Health framework, among other objectives. One Health is actually a pretty new concept, even though its core principles have been known by other names around the world for generations. Here's some of what they came up with. One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. It recognizes the health of humans, domestic and wild animals, plants, and the wider environment, including ecosystems, are closely linked and interdependent. The approach mobilizes multiple sectors, disciplines, and communities at varying levels of society to work together to foster well-being and tackle threats to health and ecosystems while addressing the collective need for clean water, energy, and air, safe and nutritious food, taking action on climate change, and contributing to sustainable development. One Health's key underlying principles are equity between sectors and disciplines, sociopolitical and multicultural parity, and inclusion and engagement of communities and marginalized voices, socioecological equilibrium that seeks a harmonious balance between human animal environment interaction, and acknowledging the importance of biodiversity, access to sufficient natural space and resources, and the intrinsic value of all living things within the ecosystem. Stewardship and the responsibility of humans to change behavior and adapt sustainable solutions that recognize the importance of animal welfare and the integrity of the whole ecosystem, thus securing well-being of current and future generations, and transdisciplinary and multi-sectoral collaboration, which includes all relevant disciplines, both modern and traditional forms of knowledge, and a broad, representative array of perspectives. I previously said the overarching goal of One Health is to promote wellness for all by building a more equitable and sustainable world. So I think it's worth taking a minute to discuss equity as defined by health professions and as used here. Equity can be explained by this image adapted from a drawing by Angus McGuire. It's a metaphor of equity for short people among people trying to watch a sporting event. In the first image, some people are given more than what they need to access viewing the event, while others don't have the same resources to be able to watch the event. This first system creates a disparity. The second image depicts equality, when everyone is given the same resources, regardless of their need. In this system, some people are still left behind. The third image depicts equity. Each person gets individualized support to meet their needs. And in the last image, the systematic barrier has been removed. Justice is depicted as everyone being able to watch the event without accommodations because the root cause of the inequity was addressed. The concept of equity isn't only applicable to physical differences like height. There are many other reasons why some people are at a disadvantage compared to the general population. This is a depiction of the socio-ecological model I adapted from Yuri Bronfenbrenner. His theory argues that the environment you grow up in affects every facet of your life. Health is impacted by the interactions between all these levels of the system around a person. There's the microsystem immediately around the individual, followed by the mesosystem with organizational structures, then beyond that, community and neighborhood structures and institutions, and at the larger level, the exosystem, with government systems and infrastructure that influences the health of the individual. Because so many factors influence health, we can't understand health behaviors without taking into account the factors external to the individual and their influence. For example, if someone misses a medical appointment with you, maybe the local bus wasn't running today and they don't have access to any other means of transit. Or maybe they have several young children at home and they don't have access to childcare. Thinking about barriers like this is helpful both when you're working with individual patients and when you're working with entire communities to gain a better understanding of the individual or population you're serving. I'm not going to delve into health outcomes right now, but briefly, the objective of public health professions and related disciplines is to eliminate health disparities. Population level health data show that people's life expectancy and risk of diseases varies based on factors like their family's income, their race, and whether they live in a rural community, but we're working on making those differences go away. In a socially just society, sociodemographic factors wouldn't predict a person's health outcomes, but they do, so more work is needed. So why do we need One Health? Today, about 75% of emerging infectious diseases in humans are zoonotic, meaning they came from animals. Overpopulation and expansion of man-made development into previously forested areas is resulting in more overlap in human and wildlife habitats. And geographic overlap and crowding increase the risk of exposure to pathogens and for outbreaks to spread. Climate change and global warming are contributing to increased droughts, extreme heat, floods, wildfires, and armed conflicts over scarce resources. Populations are experiencing malnutrition, trauma, and new disease patterns as a result. No single profession is positioned to respond to these challenges. By working across disciplines and with other stakeholders, a team using a One Health approach is better equipped to solve complex population and environmental health issues.